Cette conférence est actuellement enregistrée.
On est en masse, hein?
Bonjour à tous, merci de vous joindre à nous pour cette conférence de presse. Hello everyone, thank you for joining us for this press conference. I will send it off to Minister LeBlanc.
So, bon après-midi tout le monde, good afternoon et bonne année, Happy New Year. Today I am joined in all thanking Canadians who stayed home and gave up their usual holiday celebrations. I know the sacrifices Canadians are making. It's so very important now, as it always has been, that we listen to local public health authorities. Wear a mask, get tested if you have symptomatic. We have 2 approved vaccines to fight COVID-19. In just a few weeks, our government has delivered almost 500,000 doses of these vaccines to provinces and territories, and General Fortin in a few minutes can give more details about the hundreds of thousands of doses on their way over the coming days and weeks. We are on track to vaccinate every Canadian that wants a vaccine. Is clearly not the time to travel. Let me be also very clear. The Canada Recovery Sickness Benefit, it is not intended for travelers who are quarantining after a holiday. On a dit au Canada
to avoid non-essential travel. And we will continue to repeat that message. I would also like to speak about the Canada Recovery Sickness Benefit. My message to those who have traveled, as the Prime Minister just said, is very clear. Those who have traveled, its goal is simple: to provide workers paid sick leave when they don't have sick leave from their employer.
Canadians want us to do this together for each other and for our country. So I would now like to invite Dr. Tam to say a few words.
Bonjour à toutes et à tous, bonne année 2021. There have been 611,424 cases of COVID-19 in Canada, including 16,074 deaths. Nationally, there are almost 77,500 active cases across the country, and the average case count is at close to 7,500 new cases reported daily over the past week. The number of people experiencing severe illness continues to increase. And over the past 7 days, there were an average of over 4,000 individuals with COVID-19 being treated in Canadian hospitals, including 770 in critical care, and an average of 122 deaths were reported each day. Canada is also monitoring the emergence of COVID-19 virus variants that appear to be associated with an increased risk of spread. To date in Canada, there have been 9 cases of a variant virus first reported in the United Kingdom, and no reports of other variants of concern, including a variant first reported in South Africa. While there is a lot to look forward to as 2021 begins, we must also proceed with a full understanding of the difficult task ahead. 2 weeks ago, Canada had just exceeded 500,000 cases of COVID-19. Now, with the current momentum of the epidemic and continued high rates of infection in many areas of the country, the 5 months it took to reach our first 100,000 cases is now shortened to just over 2 weeks for the latest 100,000 cases of increase. This ever more rapid accumulation of cases will continue until we can make significant progress in interrupting spread, which is why we must all continue our efforts. Our main task this year is to stay the course with public health practices as the rollout of safe and effective COVID-19 vaccines proceeds across Canada and around the world. We have learned a lot about how to limit the spread of COVID-19 over the past year, with ample evidence to show that early, strong, and sustained public health measures are key to controlling the spread of COVID-19. And we know that whatever the combination of measures and restrictions, there is one vital factor underlying their success, and that is us. When it comes to stopping the spread of this virus, public health measures are only as effective as our collective efforts and resolve to see things through. The behavior and choices made by each and every one of us matter a great deal. As our access to safe and effective vaccine expands, let's resolve to continue supporting each other. 2020 was an unbelievably difficult year, but Canadians have made remarkable achievements all along the way, as individuals, as a country, and as part of the world united against COVID-19. To be sure, there will be challenges ahead, but we have shown that we have the strength and resilience to continue through this next chapter and see things through for a more hopeful 2021. Let's not forget the things that we've experienced, learned, and rediscovered that will be important to hold on to as we go forwards. Among them, the memories of those we've lost and a renewed understanding that none of us can have health unless all of us are cared for and supported. Thank you.
Merci. Bonjour à tous et à toutes et bonne année. Il y a eu 611 424.
Welcome. Happy New Year. Nationally, there are almost 77,500 active cases across the country, and the average case count is at close to 7,500 new cases being reported daily over the past week. The number of people experiencing severe illness continues to increase. Over the past 7 days, there were on average over 4,000 individuals with COVID-19 being treated in Canadian hospitals, including over 770 in critical care, and an average of 122 deaths that appear to be associated with an increased risk of spread. To date in Canada, there have been 9 cases of a variant virus first reported in the UK, and no reports of other variants of concern, including a variant first reported in South Africa. While there is a lot to look forward to as 2021 begins, we must also proceed with a full understanding of the difficult task ahead. 2 weeks ago, Canada had just exceeded 500,000 cases of COVID-19. Now, with the current momentum of the epidemic and continued high rates of infection in many areas of the country, the 5 months it took to reach our first 100,000 cases has now shortened. Until we can make significant progress in interrupting spread. This is why we must all continue our efforts. Our main task this year is to stay the course with public health practices. As the rollout of safe and effective COVID-19 vaccines proceeds across Canada and around the world. We have learned a lot about how to limit the spread of COVID-19 over the past year, with ample evidence to show that early, strong, and sustained public health measures are key for controlling the spread of COVID-19. And we know that whatever the combination of measures and restrictions, there is one vital factor underlying their success, and that is us. When it comes to stopping the spread of this virus, public health measures are only as effective as our collective efforts and resolve to see things through. The behavior and choices made by each and every one of us matter a great deal. As our access to safe and effective vaccines expands, and we stand at the beginning of the end of this pandemic, let's resolve to continue supporting each other. 2020 was an unbelievably difficult year, but Canadians have made remarkable achievements all along the way. As individuals, as a country, and as part of the world united against COVID-19. To be sure, there will be challenges ahead, but we have shown that we have the one. Let's not forget the things we've experienced, learned, and rediscovered. That will be important to hold on to as we go forward. Among them, the memories of those we've lost, and a renewed understanding that none of us can have health unless all of us are cared for and supported. Thank you.
Dr. New, et à vous, le général Fortin.
Merci, Monsieur le ministre. Bonjour et bonne année.
Thank you, Minister. Hello and Happy New Year.
Saying that the deliveries of both December allocations of both Pfizer, BioNTech, and Moderna are now complete. A total of 400 doses, 20,400 of the Moderna vaccine have been delivered to the territories and represent the first very much needed doses for Canada's northern communities. Canada has proven that we're ready for a sustained tempo of vaccine deliveries expected throughout the month of January. This week's shipment of 124,800 Pfizer-BioNTech vaccines is on the way. We expect a further 208,000 doses per week for the rest of this month. We're also expecting 171,000 doses of Moderna the week of January 11. We are working diligently with manufacturers and federal, provincial, territorial, and Indigenous partners to ensure a continuous and predictable flow of vaccines. We're on track to have over 1.2 million doses of Pfizer, BioNTech, and Moderna delivered by end of January. To facilitate this distribution of this growing number of doses in remote and isolated communities in the coming weeks, we continue to acquire and deliver enabling equipment and supplies to enhance the cold chain capacity and flexibility across the nation and to enable onward distribution to more sites across the country. I want to reaffirm to all Canadians that while quantities seem limited, we are scaling up. This is a deliberate operation. We are closely coordinating with provincial and territorial partners, stakeholders, and different other partners every day to ensure that the delivery process of COVID-19 vaccines continues to operate smoothly and in a safe and efficient manner to all Canadians. Alors, je suis heureux de commencer une nouvelle année en annonçant
Moderna vaccines are now complete. A total of 424,50 doses of vaccines have been delivered to the provinces and territories. Out of those, 20,400 doses of the Moderna vaccine have been delivered to the territories. These are the first much-needed doses for Canada's northern communities. Canada is ready for a sustained tempo of vaccine deliveries expected throughout the month of January. This week's shipment of 124,800 Pfizer-BioNTech vaccines is on the way. We expect a further 208,000 doses per week for the following 3 weeks. We are also expecting 170,000 doses of Moderna vaccine the week of January 11th. The Government of Canada is working diligently with manufacturers and federal, provincial, territorial, and Indigenous partners to ensure a continuous and predictable flow of vaccines. We are on track to have approximately 1.2 million doses of the Pfizer-BioNTech and Moderna vaccines delivered by the end of January. To facilitate the distribution of this growing number of doses in remote and isolated communities in the coming weeks, we continue to acquire and deliver enabling equipment and supplies to enhance cold chain capacity and flexibility across the country and to enable onward distribution to more sites. I want to reaffirm to all Canadians that though numbers are still limited, we are scaling up vaccine supply and delivery. We are taking deliberate action and closely coordinating with provinces and territories, stakeholders, and partners every day to ensure that the delivery process for COVID-19 vaccines continues to operate smoothly and in a safe and efficient manner throughout 2021. Thank you.
Merci beaucoup, Général Fortin. Alors, nous prenons maintenant les questions. À vous, Corinne.
Bonjour, merci à tous. Nous allons commencer avec les questions au téléphone pour 3 questions avec une question de suivi chacun, puis nous reviendrons dans la salle. We will start on the phones for 3 questions, 1 follow-up question each, and then we will come back to the room. Operator.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from, la première question est de Sharon Kirky from National Post. Please go ahead. À vous la parole.
Hi, Dr. Tam. Thanks for taking my question. You said there are now 9 confirmed cases of the UK variant in Canada, but I'm wondering how closely are we looking for it? Are we testing just a small sample from people who've been to the UK, or are we doing random sampling?
Thank you for the question. So Canada has been doing genomic sequencing of viruses throughout the pandemic period, and we've been sequencing as a background rate as about 5% of the cases to date, but accelerating that to the background sort of analysis, if you like. At the same time, of course, we've been broadly going out to the provinces and territories, clinical networks, laboratories, to take into account travel-related cases, but also other areas, I think, of target, whether they be specific patient groups, such as the immunocompromised. Of course, as vaccines are rolling out, we want to know if any cases are occurring in persons who got the vaccine. Those are some of the samples that we need to target as well. But also, I think, as you said, that there's some sort of background surveillance samples that also needs to be analyzed as well. So it's a bit like a sort of 3-pronged approach to the genetic sequencing.
And sorry, my follow-up. This variant overtook the circulating strain within like 3 months in England, and it's now in Canada. My questions are, how quickly could it potentially overtake the circulating strain here? And what is our plan to try and reduce transmission? And, and what this might potentially mean for us in the coming months if this variant does overtake.
That's been genomically identified, have been in travelers or their contacts. Provinces are looking at contact tracing, but as far as we know, we're not expecting that there's large numbers of contacts related to these cases. And partly, of course, is a result of the fact that we have quarantine measures in place, including the 14-day quarantine. But, there's always a risk of a virus that can transmit in all sorts of hidden ways to accelerate in different places. So the public health measures and the core public health measures in reducing contacts to reduce spread remains the same. However, you've really got to double down on your efforts with a more transmissible virus. So, getting increased, uptake and observations and compliance with these measures become really important if you're dealing with such a high variant. And as you've seen in the UK, if it does accelerate spread, it means that there will be more public health measures that might be needed. So it would become a sort of difficult situation. I'll just have to add that we actually, the whole world is sort of looking for these variants, but there may be some other countries that don't have the capacity to detect these variants. So again, the broad-based measures of quarantine and the broader measures that we have in place are there for a reason, but the community public health measures are really important if you're going to stop rapid spread.
Merci. Prochaine question.
Thank you. Merci. The next question is from, la prochaine question est de Hélène Bugetti de Le Devoir. Please go ahead. À vous la parole.
Yes, hi. My first question is actually for Dr. Tam. We see that some provinces or some regions of the country are delaying the second dose of the vaccine in order to vaccinate more people. Yet Pfizer has said that they don't really know the efficiency of their vaccine after 3 weeks after the first dose. So I'd like to know, what do you think of that idea of postponing the second dose?
Right. This is a topic of course, active discussion. And we're also going back to the National Advisory Committee on Immunizations to ask for some of their advice, looking at what we do or do not know, as well as the key considerations if people were looking at that interval. What I would like to really strongly emphasize is that Canada is committed to a 2-dose vaccine regimen. And so it's not about not giving 2 doses. And we'll certainly be keeping an eye on also sort of analyze separately. But that data looks, while it does look promising, it's just, it comes down to vaccine management and making adjustments in the face of constrained supplies. So initially, of course, given what the supply situation and the uncertainties in December, people were holding back that sort of second dose. Now, I think, as Major General Fortin has indicated, with a bit more certainty in supply, I think provinces are looking towards not holding back that second dose because they want to more rapidly immunize the population with that first dose. And it may depend on the epidemiologic situation. So the Atlantic provinces may not be in the same situation as maybe Quebec, for instance. So I think the provinces and territories are trying to manage that. But you know, that the commitment is a 2-dose regime.
So you don't disapprove, if I get it correctly. Monsieur Leblanc, j'aurais une question à vous poser concernant la...
Mr. Leblanc, a question regarding the sickness benefit. Could you tell us exactly what will be done to end this loophole and what will be done to punish violators? And what about the situation of those who have spent time with someone infected when they were at an illegal party? What will be done for that kind of situation if people become infected in that circumstance? Answer. The Prime Minister has been clear. We will prevent those who have taken non-essential trips from accessing the Canada Recovery Sickness Benefit. That benefit was not designed to compensate someone who has shown a lack of judgment and who has not respected clear public health guidelines. By traveling, especially with non-essential travel. The Prime Minister was very clear. In the coming days, we will have precise details about how we will prevent people in that situation from accessing the benefit. We also need to remember that the goal here that has been laid out by provincial authorities and health authorities is that people who have to quarantine, like you said, because their partner or someone in their household has COVID or is in preventive isolation, if these people don't have sickness benefits from their employer, if they're part-time workers or freelancers, if they don't have any way to access sickness benefits, we want to ensure that those individuals will do the right thing, stay home, they have symptoms. We want to avoid having them go against public health guidelines. We want to ensure that this important public health measure remain in place, but we don't want people who have shown a lapse in judgment by traveling abroad to be able to abuse access to this benefit, and they will not be able to access it.
Merci. Prochaine question.
Thank you. Merci. The next question is from, la prochaine question est de Catherine Lévesque de la Presse canadienne. Please go ahead. À vous la parole.
Oui, bonjour à vous tous. Bonne année. Monsieur le...
Question. Happy New Year. Mr. Leblanc, I didn't hear an answer to my colleague's question about how you will go about ensuring that travelers can access this benefit. Will there be legislation? Will this have to wait until Parliament returns, or can you act earlier? The Prime Minister has been very clear. We will prevent people who have traveled from accessing the benefit. This was a bill that was adopted unanimously in the House of Commons in September. All opposition parties unanimously supported this move, ensuring that people who are exposed to COVID-19, people who should be in lockdown, to enable them to do that. It never occurred to anyone to grant that benefit to those who had been traveling outside Canada for non-essential purposes. In the next few days, we will provide details on how we will ensure that people in that situation can't access the benefit. But as the Prime Minister said, we have a clear plan to prevent people from accessing that benefit.
Le premier moment, ce serait apprécié. Et ma question suivie, c'est...
Follow-up question regarding the vaccine. What will you be saying to the provinces on Thursday to help them vaccinate the population? Answer. Once again, the Prime Minister confirmed that on Thursday there will be a meeting with provincial and territorial premiers, and we will discuss the matter of vaccines and how the provinces can increase the number of vaccines delivered. As General Fortin said, we will be looking into how hundreds of thousands of further doses that will be arriving in the coming weeks throughout January. We're going to have many more vaccine doses arriving in Canada. And we will be delivering that to the provinces as planned. So it's a matter of seeing how the federal government can better support the provinces so they can support their population, vaccinate their population more quickly. And we will also be sending the provinces all sorts of necessary equipment in order to increase the vaccination capacity in each province. For example, family doctors throughout the country have offered provincial authorities who have offered to participate in the vaccine delivery measures. I believe that each and every province and territory is actively looking for ways to increase the rate of vaccine delivery. And as we have done from the beginning, the Canadian federal government will be there to support the provinces.
Dans la salle pour 3 questions. We are coming back to the room for 3 questions.
Hi, Tonda McCharles with the Toronto Star. Minister LeBlanc, could you speak to, as I understand it, the negative COVID test requirement applies only to airline travelers returning. And I wonder if or how or will you apply the same requirement on land border crossers? And would, for example, essential travelers, which I guess they still cross the border, are they exempt from that requirement? I imagine there aren't a lot of land border crossers that aren't deemed essential. However, there are some who have been given exemptions in the past. So is the requirement applying to them, and how will it work for essential workers?
Well, thank you, Tonda, for the question. And you're absolutely right. My colleague Mark Garneau announced that at 12:01 a.m. On January 7th, there will be a requirement for airline passengers arriving in Canada to have a negative COVID test in place 72 hours before the departure. We have been working with airlines and other authorities to ensure that those measures are in place. It's an important additional protection for Canadians. It's something that other countries have had in place. Important quarantine measures, the 14-day strict quarantine measures for international travelers. Dr. Tam and others have spoken about how that is the best practice in terms of reducing or eliminating the chance of an onward transmission for somebody who may arrive in Canada and have COVID-19. We have said that the 72-hour pre-arrival testing requirement will start with airline passengers. And as we said, it comes into effect this week. We haven't decided yet in terms of land or border crossings, land crossings. As you noted, the vast majority of people arriving at land borders are essential travelers, truck drivers, others fulfilling important essential activities for the Canadian economy, including for the health and safety of Canadians. But we're open to looking always at additional measures that would provide additional layers of protection. But we're starting aggressively and deliberately with international air travelers who arrive in Canada, but we'll continue to work with health authorities and others if they have suggestions about ways that we could further enhance those measures, including perhaps at some point the question of land borders.
Dr. Tam, I don't know if you want to add anything to that. If you do, please do so. I'll just outline my second question, and if you want to weigh in on that point, thank you. Major Fortin, I just want to understand, so the concern that a lot of people have been expressing, including the Prime Minister, around the slow vaccine rollout in many provinces is not just that it's not getting into people's arms, but perhaps it might act as a deterrent in our efforts to get swifter and more volume from vaccine companies if they see they're stuck in freezers. So have you got that, do you share that concern? Have you heard anything about that? Have any companies expressed sort of a hesitation that Canada can't manage the volume it's got, so why would we send them any more?
Well, thank you, Tonda. So I have not heard any such comment from manufacturers at this stage. What I would say is this: provinces and territories are scaling up their capacity to immunize. I think it's very important to know that as you get more reliable data on the transportability of vaccines, that helps transport or onward movement for the last mile to the point where people will where vaccine will be administered. That will make it easier for provinces and territories. Secondly, as you get more predictability on shipments, you can align the health workforce. You can align certain locations to be ready to receive, and so on and so forth. So now that we're in a better position to predict with confidence what we're going to receive in January, and in the coming days we'll be able to I guess confirm what we're receiving in the first weeks of February, and so on and so forth. That will help over the next few weeks. We'll continue to ship cold chain enabling equipment that will further bolster the capacity in the provinces and territories and provide them an ability to create additional vaccine distribution sites. So all of that put together really will facilitate the different jurisdictions to administer vaccines effectively and as safely as possible. Oh, freezers, the thermal shippers, the Credo cubes of different types, the countertop, the standing freezers, the dual temp, the single temp. I have a long list, but let me assure you that we're tracking that very closely with the different manufacturers and the providers of those equipment. Some has been, quite a bit of equipment has been distributed already to provinces and territories, and more to come in the coming weeks.
Hi there, Mackenzie Gray with CTV News. Dr. Tam, there's reports out of the UK that 1 in every 50 citizens there has the new variant of COVID-19. How important do you think it will be for Canada to extend border restrictions to keep that from coming out? And in a similar vein for Minister LeBlanc, today the Prime Minister urged Canadians to not travel internationally. But like many things the federal government has urged Canadians to do during the pandemic, many people are not listening, including a number of politicians. This is something that is solely in the federal government's jurisdiction. Why is the federal government, if you believe so strongly that Canadians should not travel internationally, why are there not stricter regulations in place to make sure that Canadians cannot do so at this point in time?
Well, so perhaps I'll start with the second part of that question, and then Dr. Tam or others in Ottawa may want to add. We've said consistently that it was unrecommended. Public health authorities nationally and provincially have, since the beginning of the pandemic, advised against foreign travel, non-essential foreign travel. It is a global pandemic, which means if you decide to go on holidays in the Caribbean or acting in a way that's irresponsible and doesn't follow the best public health advice that has been available publicly for many, many months. So our government has added additional measures, for example, the requirement for a negative PCR COVID test before being allowed to board a flight coming back to Canada. That measure, which is coming into effect at 12:01 a.m. On January 7th this week. We're always looking at other measures that would better protect Canadians. We've said from the beginning of the pandemic that we are constantly reviewing the measures that are in place to see if we can add additional layers of protection. There is a misnomer circulating that somehow the government of Canada can legislate against travel outside the country. If you look around the world at countries that have requirements for exit visas, I'm not sure we want to be on the list of those countries. But any measure that tells Canadians that non-essential travel internationally should not be undertaken is something that we're prepared to look at. We can't be more clear. And I think Canadians themselves, a testimony came from frontline healthcare workers who are carrying an enormous responsibility across the country to protect all of us. And they have seen, and they are expressing very clearly, a totally understandable frustration at Canadians that might disregard the public health advice and undertake non-essential foreign travel. So we totally understand that very, very reasonable frustration of Canadians. And we're going to continue to take every measure necessary to ensure that that practice doesn't continue.
So I'll just add to that response by saying that I think right now, and the next months are going to be really difficult in Canada. So, reducing any risks of importation and escalation of the pandemic in Canada is really important. As you've seen, mutations of the virus can occur all the time, and these variants of concern that have mutations where we are worried, whether it's increased transmissibility or other features, can actually come up in different areas of the world, not just the UK. So these broad recommendations of avoiding non-essential travel is really critical. I mean, can be respected. We're going to do as much as we can to beef up looking at our enforcement measures, if you like. The travelers from the UK, as well as those from South Africa, for now will still be picked out of the lineup, if you like, as they enter Canada with questions on those pick machines. And they will be given additional scrutiny by the public, our quarantine officers. They will require soon, of course, the pre-departure testing to be put in place. But we will be, looking at them from the perspective of additional quarantine oversight. If you like. But this can pop up anywhere, which is why it's really important to maintain these broad measures and not just one country at a time. The other thing, just to add, is that if you're in the UK, they're now in their highest level of lockdown. So their advice is that no one goes out of that country for anything but essential and sanctioned travel as well.
One of the things that we heard from provinces in terms of why they're not able to roll the vaccine out quick enough is that potentially they don't have enough staff. We've heard from retired nurses and other former health professionals saying, hey, I can help, put me in. Is that something that you expect that will happen later in the pandemic? And Minister LeBlanc, also on the vaccine rollout, you said yesterday that we expect it to be efficient. Clearly right now, the rollout has not been efficient. Outside of procuring more vaccines, what specifically will the federal government do to make sure the provinces can get the vaccines out quicker than they've done right now?
So you asked 2 or 3 questions in the same question. I'll answer the second part of your question, then Dr. Tam can also add something. The Prime Minister has said that we have convened a meeting of First Ministers, all the premiers, on Thursday late afternoon, a couple of days from now. One of the items we want to discuss with them is the issue of vaccine rollout. Major General Fortin and his colleagues at the Public Health Agency have done an extraordinary job in terms of the logistics of delivering hundreds of thousands of vaccines in record time and with extraordinary care to provincial sites determined by the provinces and territories. And they're going to continue to do so. As General Fortin indicated, we're also providing a whole series of supplies necessary for the safe vaccination of Canadians and supplies necessary to properly hold vaccines while they're rolled out in provinces and territories. So the Government of Canada has done, I think, a very, very good job of helping provinces prepare for the vaccines, not to mention, obviously, the fact that we've procured and paid for these millions of vaccines that will, as the General said, be ramping up very significantly over the coming weeks. So the conversation on Thursday night with First Ministers will be, how can we work together to ensure that there is no unnecessary lag time in those vaccines once they're delivered to provinces and territories at sites that the provinces and territories have determined, that those vaccines are promptly distributed to the appropriate population. So the Government of Canada stands ready, as we have from the very beginning, to do whatever we can to assist provinces and territories. But the vaccination of their populations is properly a provincial responsibility, and our job is to do everything we can to support them in discharging that responsibility as expeditiously and safely, obviously, as they can.
Thank you. Sorry.
Actually, don't have much more experience in deploying vaccines, including the seasonal influenza vaccine. And we've heard many health professionals coming forward to say, we can help. I think partly is, as Major General Fortin has indicated, that some of the complexity of the cold chain of the initial vaccines needed to be worked out. And there's more instructions or guidance from the manufacturers as they are coming out and allowing the further transportation of the vaccines, then more and more people can help. But as you've seen, the provinces are rolling things out a bit differently in terms of how they construct the clinics, etc. So we'll certainly be providing support if needed. I know that we have the Canadian Red Cross and others, on tap, as it were, if there's any additional support that's required as well.
Thank you. So we have about 5 minutes left, so we will take one last question in the room.
Hi, Happy New Year, everyone. David Thurton, CBC News. I just wonder if you could tell us what reports have you been receiving, doctors or Major General Fortin, about the wastage of vaccines? And is this wastage that you're seeing, if you are getting any reports, is it out of the ordinary? Or is it more than what you might have expected?
I personally haven't heard of any wastage in vaccines. I'm not sure what the definition is of. Can you be a bit more precise?
Yeah, well, we're seeing reports out of Alberta and Manitoba that there are some doses left in vials, and because of the storage requirements or the strict requirements around these vaccines, that last dose in that vial has not been able to be used because, I don't know, maybe they ran out of people to vaccinate and, for the allotted period of time. And so they've had to basically throw away those last doses in those vials. So we're seeing definitely reports in Manitoba that they've seen some wastage. The Alberta Health Services has also had to respond to some reports as well as that. So I'm just wondering, at the federal level, have you received any reports of vaccine wastage, and is it out of the ordinary?
I don't know of any reports that's been forwarded to us in terms of vaccine wastage. I think just prior to the Christmas period, we've heard that from a regulatory and other, from the manufacturers, that you can, if there's actual enough for another dose from the 5-dose vial, you could use that. there may be other reasons why all the dose is not used. As you said, it could be at the end of the day, there's some scheduling issue that they couldn't schedule a lot of people, at the same time. I don't know anything about that, so I think that would have to go back to the provinces. But yes, there is, in the 5-dose vial, we've been advised that if you can get an absolute full dose out of it, you can use it.
Just as a follow-up, what advice, what recommendations are you giving to the provinces who might be encountering this issue already, or as the vaccine, 50 people today, but only 48 show up, and there's 2 doses left in the vial? What is your recommendation to the provinces to maximize and to make sure that every ounce, every drop is being used?
Well, I think we have at the working level a vaccine supply working group that is, and the Canadian Immunization Committee that is sharing all the best practices that people need to do. And that's really in the provincial jurisdiction of rollout and planning of the clinics. But I'm sure there's lots of best practices that people can have. Yes, there may be specific characteristics of these vaccines, which means you can't just sort of put them back in the fridge and then keep using it. But I think those kind of data will increase as we're going along from the manufacturer as well in terms of flexibility. But I think, vaccine clinic planning, of course, is important. But that's really not sort of in our federal jurisdictions, but we're very happy to facilitate any best practices amongst the jurisdictions.
Bonjour, merci à tous. Thank you, everyone. This puts an end to today's press conference.